Welcome to the Heart Wide Open Wellness Podcast, where we explore therapy, Kundalini Yoga, and all things holistic wellness. I'm Hannah Zachary, LMFT, International Retreat Leader, and Curious Human. Whether you're tuning into us via social media or any of the major podcast platforms, we're so grateful to have you here. Here's to opening our hearts and exploring life together. Welcome to the Heart Wide Open Wellness Podcast. We are in for a treat today. We have my friend and Dr. Sharrock available and with us today. She's a busy woman, so I'm so grateful that she had taken the time to share some of her really empowering knowledge of holistic health and wellness. And I'm going to be reading her bio in a moment so you know a little bit more about her. But she and I have known each other for many years now. I know her husband and her family, and we have many mutual friends and have been in a similar approach to wellness for a long time. So it's always a pleasure to connect with somebody who is out there doing the holistic thing. So I'm really happy to have you today.
Thank you, Hannah. I'm happy to be here.
It's wonderful. And so from a professional standpoint, for those of you that don't know her, Dr. Nicole Shorrock is an MD, IFM CP, is a pediatrician and functional medicine doctor with over a decade of experience treating chronic immune gut and neurologic conditions, including autism, Lyme, and mold illness. Those are all such a big deal. I'm so glad that you're on the charge for those. After recognizing the limitations of conventional care, she pursued integrative approaches rooted in somatic therapy, craniosacral work, energetic medicine, and autonomic testing. Dr. Sharrock empowers patients to reconnect with their body's wisdom and uncover the root causes of illness for true healing. So amazing. And again, thank you. What did I leave out from?
It's hard to summarize actually what I do because it's been something that's developed over the past 25 years of my life. And I definitely feel like the physician I was even last year is not the physician I'm practicing this year. But in general, I'm an integrative medicine physician. Mm-hmm. And integrative medicine is the practice of medicine that focuses on integrating whatever it is that the physician is becoming skilled in as a tool in the toolbox. And I first started my integrative journey 15 years ago when my husband became ill. Mm-hmm. And we found ourselves in the world of functional nutrition and functional medicine, and then moved into more energetic medicine through the practices of homeopathy and also herbs and energy medicine using frequencies. And all of that combined kind of created the integrative medicine that we practice. But I also think integrative medicine is integrating the entire body, mind, spirit of the patient in the care plan. And that's a big focus of kind of how we approach the body.
Yeah, and so necessary because you can't heal one without healing the other, yes. Right? You have to lift all of it at Absolutely. The same time. And 15 years ago, there wasn't as much support, as much awareness, as many resources. So yeah, just like, how did you get into it? I mean, obviously your husband is a key reason to...
Yeah, I think at that point I'd been a pediatrician in conventional medicine for about 10 years. And I was seeing more and more illnesses that were chronic and recurrent and persistent in children, and also more autism, and realizing that I didn't really have the skills to understand what was happening, like why the patients were sick, really. And then next level is how to recover it. You know, I kind of had that awareness, and that was slowly developing.
What do you mean you didn't have the skills? What was missing?
Well, in medical school, you know, you're trained that you look at a pathology, and 95% of your time you're focused on making the diagnosis. So the training is these symptoms, this physical exam, they equal this diagnosis. Mm-hmm. And then once you have the diagnosis, it's like you're kind of almost done. And here's a medicine that stops those symptoms. But what was really missing was how did that disease develop in the patient, and what were the root causes of that disease? I mean, it sounds so silly now.
It does.
Coming out of it and having that awareness of like, wow, I don't know what's causing the chronic eczema or the asthma. I mean, I know it's an allergy, right? But I don't know why the patient's having the allergy. It's that next deeper level of like really questioning what's happening here. And then I think when my husband became
Mhm.
ill, it really forced me to recognize that I didn't believe in the training that I had. And I had to quickly kind of decide how I was going to navigate that and figure it out because his health and his life really were on the line at that point.
Absolutely.
Yeah.
So you immediate what did that look like immediately? And how did you know like
Yeah.
this is I'm not satisfied with this because it just intuitively you knew you didn't have everything you needed to help him.
Yes, I knew what wasn't working, but I didn't
Yeah.
actually know what to do.
Yeah.
And I think that, how our life just kind of lines us up in the right way so that everything is happening in perfect timing and perfect, conversations and things like that. And so I think that journey actually started probably a year and a half before he became ill. I found yoga actually and started to do yoga work and realizing through that process how important my nervous system and my attunement was. We started meditating, and I believe that our awareness of his illness was perfectly timed after I had had that experience of how connecting to ourselves can be healing and nutritive and understanding how important that was.
Mhm.
So that then when we came into the environment of the diagnosis is confirmed, you have this form of multiple sclerosis, it's very severe.
Mhm.
And, here's our prescription medication plan. And by the way, probably with or without this medicine in 5 years, he's going to be wheelchair bound. And in 10, he'll probably be dead.
Wow.
It was a big deal. And
Big.
at that time, it was pretty scary.
And did you have kids at that point?
Yes.
Yeah.
Yeah. We had 3 kids. Actually, I was pregnant at the time. And it was it was a very intense time.
Mhm. I can only imagine. Yeah. And so you were doing more functional medicine and then also just so listeners know, you now have been running Ollie Health
Yes.
as yes, the
Mhm.
owner and founder there. And for how many years have you been there?
Ollie just celebrated its 5th anniversary
Wonderful.
birthday. We called it a birthday. We opened in March of 2020. People might know that date.
That is
It was
right there.
also just like this really explosive situation. But, at that point, I had been practicing functional medicine in a conventional environment for, almost 10 years.
Yeah.
And I really wanted to make that work because I wanted to be able to change the system that I was in, and I was dedicated to it. But it wasn't really moving. And what I didn't realize was how much it was actually holding me back because I was still needing to be a part of that culture to an extent that didn't really allow me to really open up into kind of the next level of integrative care that I really entered when we started Ollie.
Okay. Okay. So I want to hear that's 5 years ago. Let's jump back. So when Rocco gets sick.
Sorry, guys. Yeah. Pause. Yeah.
Yeah. Yeah.
Yeah. That was I call it like the dark night of my soul, really, where I saw that my world and everything that I had safety in pretty much dissolved all at once. And I think sometimes, that happens in that way for a reason, so that because we never reach for something when we're comfortable.
Mhm.
And at that point, I had been uncomfortable, but not enough to make a change that was significant.
Yeah.
Sure, we've all been there and we can understand that.
Yeah.
But this was a very intense discomfort, and there was a lot of fear that I um, was experiencing from all angles, and just really needed to dig deep and ask myself, what did I really believe in?
Mm.
And stay close to really getting out of my head and getting into my heart, so that I could navigate that in a way that was aligned with what I already knew.
Mm-hmm. So, I mean, there's so many things as a doctor that you can inform us, and as a human, what did you do to navigate your own internal compass at that time?
I slowed way down.
Mm-hmm.
I eliminated all non necessary things that were maybe kind of superficial and fun, but not really like just maybe distractions in a
Mhm.
sense. I changed
Mhm.
my lifestyle a bit.
Mhm.
And let's see, I really focused on like what's really, really, really important.
Yeah.
And that just kind of brought the awareness to the surface.
Yeah. I mean, awareness is everything, right?
Yeah.
Mindfulness, awareness,
Yeah.
and being available to the intuitive hunches
Yes.
and then honoring them, right?
Absolutely.
So in that time frame, what became really true for you?
Um, well, I realized that for me, healing was a spiritual journey, and I believe in the physical medicine. Obviously, I
Yeah.
practice physical medicine,
Yeah.
but I think that I knew that the illness was a deficit of like connection to self, connection to soul and spirit. And also, I realized that the medicines that I had been trained to use were not aligned with reconnecting the
Mm.
body in that way. And so it really pulled me more into food and herbs and natural based medicines, because instead of coercing the body or trying to turn the body off and whatever that mechanism was that the
Mhm.
immune suppressant medicines they were recommending were. And at that time I didn't really know what was driving the MS. I didn't have the education yet to know that it's an autoimmune disease. It's driven by chronic infection in the microbiome, which is driven by chronic toxin in the body, and that's driven by trauma. So going down deep into that, I didn't really know those details first early on. I just knew what felt right as far as like, what are we willing to do? How can we line up with his body instead of actually suppressing or stopping something that the body is doing? Because at the basic principle is that our bodies are brilliantly made and perfectly made. And as a physician, I wanted to line up with the power of that.
Mhm.
And when we are experiencing an illness or a symptom, a lot of times it is the body working in a way to really protect itself in some way. And for example, with autoimmunity, if we take the drug that stops the symptom of the MS, we are suppressing the immune response. And first of all, this is not medical advice. Sometimes
Mhm.
that might be very important. If someone's going to stop breathing due to their autoimmunity, they need that medication.
Right.
Okay,
Right.
but what I realized was what I would rather do is align with the immune system to help it redirect and function better. Understand why the immune system was doing that, and in his case, he had Lyme disease, and so figuring out what was happening there and treating that infection
Mhm.
so that then his immune system would stop attacking his own myelin. I mean,
Mhm.
and also in the perfection of the body, the immune system never attacks our bodies without um, some reason, and it isn't the wording's wrong. It doesn't attack our body. It's actually trying to clear something in the body that needs to be cleared. So in this case, for example, maybe a Lyme organism that's chronic in the body, the immune system makes its antibodies to Lyme, but then there's proteins on that bacteria that look a lot like the myelin in his brain.
Mhm.
And
Mhm.
so it's like this molecular mimicry is what we call it, where it actually, as a side note, the myelin goes. So if we suppress the immune system and we stop the immune system from working, what doesn't get better is the Lyme. In fact, if anything, theoretically, in theory, it could be worse, which is why when
Mm.
we looked at this data, and I looked really closely at the research
Mhm.
at that time, and this was a long time ago, but
Mhm.
patients after, they would have a good response for a few years, their MS symptoms would get better.
Mhm.
At 5 years, there was no difference between placebo, and then further on, there was harm. And that makes
Wow.
sense, right? And
Yeah.
understanding that the bot we're
So it's band-aiding the symptomology up
yeah,
front, but then it's not creating any cure past a certain point, and even possibly negative, possibly.
possibly. I mean,
Yeah.
that's the thing. If you have a
Yeah.
chronic infection, you don't think you should probably suppress your immune system,
Right.
right? And so and most autoimmunity is that. We don't use the word infection because that's, when most people hear infection, they think, well, you're going to have a fever, you're going to
Mhm.
have, that's an acute. infection. It's like in the moment we have a strong infection. A lot of these cases are chronic, low grade immune responses to these organisms in our microbiome.
Well, and that's why they're so tricky, right? Because
they don't show up with fever. In fact,
and they've caused so many random symptoms, right? Is that
Yeah, because the symptoms are driven by your patient's personal tension patterns. Like if I, for example, was born and had a birth trauma with a cord around my neck and I had a tension pattern that developed there, I might have vulnerability for my illness to show up in my throat. Versus if someone else had maybe some kind of trauma that involved their low back, they may have actually their illness, even though it's the same illness, show up in their gut. Yeah. So understanding how these things work is a really big part of the medicine that we practice, and really looking at your individual patient in front of you and their story. And their story is unique to only them. So this idea that we can just like everyone needs probiotic or everybody needs vitamin D or whatever it is.
Everybody should be cold pledging. Everybody should be blah, blah, blah.
That's not true.
No, it's not true.
It's not true. But also this medicine is at some point extremely simple, because if you can understand how to understand your patient and see those patterns in their body, those patterns of tension, or understand how their body responds to their environment that's unique to them, then you can be empowered to help them with it.
Yeah, it could be equally. I mean, I can see from one angle that could be very overwhelming because there's a lot of input and recognition. And how do I make sense of all this? So what do I do about all of this? And the flip side is how hopeful it is, right? That if you believe that the body can heal itself and you believe that the body is giving you all the signs, then you are at least possibly going to be able to go into this direction of healing. I've worked with, I've always done trauma work. So I've worked with quite a few people who have had autoimmune and significant Lyme, where they have mast cell activation and they can't really, their attempts to better themselves are very slow because they have a lot of sensitivity to the progress or the implementation of what could be healing, and it can heal them. It's just it feels to them, in my observation. So I'm curious, like it looks like it's 2 steps forward, 1 step back, 2 steps forward, 1 step back. And then you get a little leap. And ultimately it's always been worth the process. But it just dawns on me like how, in a way, what an intimate form of exercise functional medicine is. It's like really seeing like I hear you're making space and treating each person individually. But I mean, this is really seeing them individually.
Well, even our first like encounter and an appointment, it's understanding their entire story, from their parents and grandparents' histories and significant
your family treeing the whole thing.
Yes. Yeah. To their birth story, to their childhood, and on. And as we're hearing that story, 2 things are happening. One is that we're seeing them in a way that's very important,
which is part of their healing.
Therapeutic response. Yes. And then the other piece is that we're getting connections and we're saying, oh, this thing that happened at age 9, like it's interesting to me because I know at age 9, that's, the age and stage of development where we're going through this piece. And then you had this experience just at that same time. And then we started developing these things down the line that may be related. And so putting it together makes it simpler, because the story, you need the whole picture to be able to do that. And it's very powerful too, because patients, when you share something back to them that you see that they've shared with you, and it resonates with them, it's them seeing themselves in a way that maybe has not happened before. How you have to be a little farther from yourself so you can see yourself.
Well, it gives them permission to kind of know what they already know, like at some level.
Yeah.
It's like, I can trust that. I can see that. And then they can own that. And then once they recognize, they can start to say, well, now I can do something with it, possibly too.
Yeah. And those clues, those clues of understanding the patient, they play into the picture of how do we approach it? Because I always have this analogy of like you're in a boat and there's 10 holes in it and the boat's sinking. Well, you don't want to just plug one hole.
Yeah.
You want to plug all the holes.
Very good point. Yes.
But you can slow the sink. But the goal, of course, in medicine is to, really
Yeah.
plug all the holes together. And I do think it is plugging them all together. So that's where the different layers of the approach
Mhm.
is so important, because we're going to address the physical layer of the illness. Like if someone hasn't been absorbing their nutrients for
Mhm.
10 years,
Mhm.
they're going to need nutrient dense food,
Yeah.
maybe micronutrients, digestive enzymes, like things to really help the physical
Yeah.
stature of the body. Maybe they need the infection that's in their gut treated, and resetting the nervous system and helping the nerves regenerate. I mean, all those things are very physical things,
Mhm.
and that's a foundational layer, which is why I think it's so important to harmonize the work we do with the therapies,
Mhm.
with the physical medicine.
Yeah.
And at Ollie, we have a team,
Mm.
and and we have the doctors, we have our somatic therapist, our dietitian, our visceral cranial sacral therapist. We do biofeedback and like things, and all of those pieces are a really important part of plugging all 10 holes.
Yes. I love that.
Yeah.
Yeah, it's so, so important. And I know this about you. I know that you are looking with all of that and bringing in so many supports with that, which is why you're here. I want you to share that story and
Yeah.
share that. So when you were kind of first discovering, and you hear unfortunately more and more about autoimmune disease, and you hear a lot of people struggling with that. And again, though, there's also, I think there is, come back to that sense of hopefulness. There is a little
Oh, yeah.
bit, we know more, and there are more treatments available. We're in recognition of how important just regulating the nervous system, working with the vagus nerve, clearing your trauma, supporting yourself with good, healthy, nurturing people, friends, lifestyle, nature, all of these things. I always tease like the more I know, the simpler it gets, really. Just make it
Yeah,
super.
that's exactly it. I mean, it feels like, immune dysregulation, and we can call it autoimmunity, but like
I like
it,
that.
yeah, it is really present in almost every case that we're seeing
Hmm.
on some level. And the question is, why is that happening? Usually it's linked to the microbiome. I was sharing a few weeks ago that we are 99% of our metabolome and our genes are produced by our microbiomes.
Hmm.
And so the health of our microbiome is very predictive of the health of our bodies. And we're living in a
Yes.
world where that health is really struggling for all the environmental reasons. But when that immune system is triggered or off balance and not working well, that it's usually because the microbiome is off. And the microbiome is usually off because of toxicity. And this is so simple because it's probably present in 99% of the cases that we're working with. And if we understand that, and then the toxicity, what really I think is something I've evolved to appreciate is that how our state of our nervous system can determine whether we detox one molecule a day or a million.
Wow, that's quite a difference. Yeah.
Yeah, it's a huge difference. And so if we're in stress, fight or
Hmm.
flight,
Hmm.
we're not detoxifying. The body is naturally
Holding on.
holding
Yeah.
on. And if we're able to reset that and go into that parasympathetic tone,
Hmm.
we're resting, we're digesting, and we're detoxifying.
Hmm.
And that's huge, because you might be able to be in a million times more toxicity and not have it accumulate as some form of
It
disease in
flows
your body.
through. Yes. Yes. You don't have to like retain it.
Yeah,
Yeah,
exactly.
for sure.
But a lot of the stress responses that we see are not conscious stress responses. Like it's not like their
Of
mind is
course.
stressed. I mean,
Yeah.
we all have our mental stress,
Yeah.
but it's a body stress.
Yeah.
And that's where the memories and the trauma responses in the tissues
Hmm.
that we can inherit from our parents and our grandparents, or we can experience and have it hold from our own personal experiences, all
Hmm.
those routes. That is the part that we're bringing in that sensitivity as a physician to be able to feel that in someone's body, which is the
Hmm.
cranial sacral that we do,
Hmm.
is really amazing. And a big part, I think, of like seeing the patient at all on all levels.
Yeah. I, I can't say enough about cranial sacral. I do think it's the magic medicine for sure. So, what were some of the very first? So, when you really realized, okay, I need to know more. I don't know what I need
Mhm.
to know in this stage to help not only my family and my husband, but
Mhm.
whoever else I'm here to serve. Like what you mentioned frequency, right?
Well, I just want to say that the first thing is that I don't deserve credit for figuring this out, and that the first thing that I did was surrender and pray to be guided to show me
Yeah. Amen.
what is the medicine.
Mm-hmm.
And I let go of me as my own mind and my own ideas as much as I can. I still do that every day.
Mm-hmm. I believe you.
And because I know that that there is a very powerful current that is aligned and all knowing, and I can feel that in my body.
Mm-hmm.
You know, when someone says, "Hey, I think you should learn about,
Yeah.
I don't know, snake oil."
Yeah.
I go, "I don't really feel pulled to that." And I'm checking in, like, "Do you want to do that?" "No, I don't want to do that."
Mm-hmm.
And so this process of working through that has been really about listening and what resonates with me. And also what I learn is probably not perfect for the next person, right? Because I'm coming in with my own, hopefully, form of genius and that is in service, and that is my intention, to be of service. And then my question to myself is to ask for showing me, not of myself, but of that, is to show me where. And then I feel it. I go, wow, I really need to learn. Like FSM is a good example. That's the frequency specific microcurrent. This was I don't know, 12 years ago, and somebody said something about it, and I just had like this. I need to learn about that. And it's been an incredible thing that now that we use, where you
What is it? Tell us.
Yeah.
I love
Well,
frequency. I love vibration. I love everything about it.
Everything in nature has a frequency.
Yes.
And when something is not in harmony with its frequency, it's diseased in some way. Diseased, I should slow that down.
Mm-hmm.
But so, for example, if someone broke their arm, and that's a trauma-induced issue, but there's a frequency for the bone, and there's a frequency for healing the bone, torn, like a broken heat frequency. So we pair those, and it heals the fracture, and it is amazing. Like, I mean, I have so many patient stories that just and every time it happens, I'm still like, a child at the candy store, like, "Oh my gosh, it happened again," But it's funny because you think I would just expect it, but it's just so exciting to be part of something that looks and feels like a miracle, but really it's just using science in a way that we haven't really evolved yet to totally understand. So we're talking about cellular level frequencies, like, and how these are known and how they work is just kind of also wild. But you know, that's something that I was pulled to learn about, and then having that experience of how that supported the patients in a way that really I wouldn't have another tool in my toolbox to do that. So it's been great.
I love that so much.
Mm-hmm.
I love that, just listening and being attuned and, stepping towards what I truly believe that the desires in our hearts are put there, and that those are an ask to move towards it. So that's kind of how my rewording of what you just said is just like, if this is something that is pulling my interest, then it must be of use for me some way, or it's going to grow me. It's going to show me the next step. It's going to whatever. Whenever you're really, really in that space. And one of my favorite prayers about kind of what you're doing, how you're talking, that I'm praying it a lot lately. It is, I want what you want, and just being like, where it's like it forces me to like get out of what I think is right, and just be like, I want what you want, and then I'll consciously let the things that I think I want flow through my brain while I say that. And it's interesting because so many of like stuff that doesn't matter just washes away, washes away. And then normally I have no answer what that is. I just usually know that like, go that direction or go this way. And then, I don't know.
It's a superpower.
Yeah.
Because efficiency is important.
It is important. Different topic on that. Like they say, like the moving into the divine feminine, the feminine energies of the world. And the feminine is it is a superpower. It's very much like move into it, reflect, get the next direction, move into it, receive, rather than blow through, which is also useful. It's more of a masculine energy, and that's needed at times to just be like, we're going to get this done. I mean, we need that. But I think that's what we're talking about.
Absolutely. Mm-hmm. Yeah, I mean, that's kind of what happened in that critical moment where my husband's health was on the line.
Yeah.
It's like when I say I really needed to slow down,
Yeah.
it was because I was go, 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 and
Yeah.
focusing on get this done, get that done, get this done, the to-do list.
Yeah.
And there's no power in that.
Yeah.
And there's no wisdom in that.
No.
And you can
No.
work really, really hard and not really move the needle. So,
That is so true.
yeah.
That is so true. It takes a lot of faith to do that, though. Like I'm just thinking about, you are seeing the whole person. You're probably hearing a lot about their bigger picture life, right? When you're working with them. What have you found useful to support somebody in their, maybe if they're a little bit uneasy in that, maybe not quite as trusting yet,
Oh, yeah.
what advice do you have for people that are just
Mhm.
trying to kind of like, I want to trust my body. I want to trust
Right.
this, but I'm not sure if I can yet.
I mean, I think the very first thing that comes to me when you say that is that I lead by example.
Yeah.
Like in my own response to understanding their story, too, is
Mm-hmm.
trusting. I don't know why, but I have very strong faith in understanding and seeing how, well, I guess I do know that my life has reinforced this belief, but basically that everything that happens to us is happening for us.
Mm-hmm.
And I experience that in medicine every day. And the health crisis becoming the biggest blessing is the story. And it's the story over and over and over.
Yeah.
So it makes it easier for me to hold it.
And,
Even when
people can
someone
feel
else-
that.
Yes.
And then, yes.
Even when someone else can't see it yet,
Mm-hmm.
I can say, I have this experience. I've seen this.
Mm-hmm.
And, I don't know what it looks like for that person
Mhm.
because it's their journey. But I believe that you're exactly in the right place.
Yeah.
Exactly in the right time. Every conversation you have is in its perfect space. Every experience, every symptom that you feel.
Mhm.
A lot of times when patients first come
Mhm.
in, and this is not our mast cell patients, but like they may have cancer or a very serious autoimmune disease and they don't really have any symptoms. They're like, I'm fine.
Mm.
I felt fine. And as we go
Those ones come to you because of blood work or because of diagnosis?
because of the diagnosis,
Yeah.
right? It's like, well, I'm
Yeah.
I'm dying.
Yeah. Help me.
Help
Yeah.
me, I'm dying.
Mhm.
And a lot of times they're not very sensitive to what's happening in their body, which is actually, I think, why they got that far along in an illness
Right.
without really knowing that they had the illness.
Yeah.
But as the process goes on, they are increasing their awareness and their sensitivity to their bodies, but also to the bigger picture of how things are happening in this perfection way that is pulling them and pushing them and supporting them in these directions, in that flow. And it's really beautiful to witness.
So beautiful.
I feel like I'm so blessed to do this for my day job.
Yeah. Right.
'Cause it's amazing. Yeah, it's incredible.
It's amazing.
Mhm.
Okay, so tell me, I just listened to you speak at an event where we were kind of both part of Healthy Eldorado. We were talking about different things, and um, what would you say? Like, where is your heart in this now? Like, what keeps you? Yeah.
Well, I think that there's been an evolution in the medicine that I practice. Early on, it was like, oh my gosh, there's a root cause to these conditions. This is baby
Yeah.
Dr. Sharrock. Okay?
Yes.
There's a root cause to these things, and I can work on the root cause. And it was very like, a physical thing for a physical thing, and then it started to deepen, into wow, the emotional component here is really big. And the mental comment is really big. And then I think even greater was the spiritual component. And that's kind of when that landed was when my husband's crisis really kind of happened at that time. And, but then the medicine, what I'm really passionate about right now is how we can help each other heal through relationship. And I mean, and there's so many different ways that relationship can happen. But for me, it's with my hands with the patient and in relationship with their bodies or their hands with their body and supporting them in attuning to that perfection is the word I want to say, but it's like attuning to the healed place that we all have, that we get pulled this way or that way as part of our human experience. And I love just like journeying through and helping to shine a light on this connection or this connection or this connection, um, from that intention of helping the patient to deeply know themselves.
You know, I'm actually kind of like, whoa, because I think the last few people I've talked to, especially in a podcast forum or just in life, this, which I couldn't agree more, just the connection piece, whether it's relationship or a connection to self, connection to something spiritual, connection to nature.
Yeah.
It just seems to be the answer for so many things. And I don't know, it's refreshing to me now that I've settled into it, but I also know I'm just going to speak for all those people that, and I was there at one point, like the hyper independent part of me that's like, what do you mean? I got to do it out here on my own, And I think it's an interesting place to be, especially in our culture, which does give so much positive feedback for being, kind of solo or self-made, and all those things are amazing. But you also just really, if you can do that while being in connection, that's the key. And
Yes. Yeah.
there's not a lot of modeling on that, and I think that's shifting. It's definitely shifting in our fields, but I think just in cultures it's shifting too.
Yeah,
And
absolutely.
I hope so.
I hope so too.
Yeah.
Because it's hard enough to do it together.
Yeah. Yes.
I mean, actually, that
Yes.
sounds, it's brilliant to do it together when we can get ourselves settled and show up. I mean, part of that is how I devote my work to keeping myself centered is very, very important as to how I can show up for somebody else. And so in that way, I guess there is some independence and there's some radical accountability.
Yeah.
Right.
And we need that too. Yes.
That piece. And also being in relationship with someone is scary. Yeah. And I think a lot of people may not feel safe in having that vulnerability of really truly being seen. And obviously, this is not usually appointment number one with me.
Right. Okay. You guys, you're not going to come in.
I'm sharing my heart with you right now about, and our relationships are long-term and over time, and we're meeting people where they are. And I think that's really important. And I think also that our society, where our culture is very dissociated, and all the tools that we have are dissociating. It's like, and they're great tools. Like AI is going to be amazing. Yeah. But it is also it's outside of ourselves. So helping when we live in a world of everything is outside of us, how do we help ground our patients and our children into learning how to feel themselves? Because that is the only way to heal yourself.
Right.
And that is the other thing, that I'm not healing other people.
Yeah.
They are healing themselves.
Yeah.
And I stay focused on what I have empowered to do, which is to take care of me and my nervous system and my connections.
Yep.
And then I am showing up with that intention of service. But the healing that happens is absolutely their work.
Yeah.
And it's really important, because I think that's also shifted, the doctor-patient relationship in conventional medicine. Like, you're the doctor and you're going to do,
you have the answers.
Your patient, and you're responsible for helping them do that. And I, of course, I think it's that's what they're coming to help doing things.
Right.
But the ultimate responsibility is actually theirs. And it's also the ultimate accomplishment when they heal themselves.
Well, and then they have a belief that they can do it again. They have a belief that they can sustain it. They have a higher confidence of their capability. I mean, absolutely. I think in our field too.
And they turn around and help.
Well, and that's what happens. And it's just this domino of healthy brilliance, really. Yeah. I mean, we do the same thing. It's like, constantly we tell our clients, and my team tells their clients, it's like, we don't have your answers. You have your answers. We can give you some ways to look at it differently. We can give you some ways to explore. We can help you decide, where did that come from? But ultimately, like all the directions, and then, it's within you. And then when people can step into that for them, that sense of, because then it is radical self-ownership, right? When you can step into that, then you can take care of this, then it's safer to go into that community part because you already have this.
Totally.
Then you go there.
Yes.
Yeah.
Yeah, I think sometimes, I think we all know this in the field that we work in, there can be almost unconscious sabotage to progress.
Yeah.
And it isn't always a mental awareness of like, how am I allowing myself to stay in this place of illness? It can be very unconscious. And I do think it's important that we talk about that, when we witness it. It isn't often that I witness it, but it is sometimes a piece of the puzzle.
Oh my God, I love you so much. But right now I'm like, okay, everybody should go to Ollie Health because you're like the only doctor I've ever said say that. Like, that's amazing.
Okay. Well, I mean, it's really, really important.
I know.
Because if we don't clear that elephant from the living room, we're not going to make any progress.
Yeah. We get in our own way a lot.
Yeah.
We do. And it isn't intentional a lot of the time, like you say.
And there's no shaming or blaming.
No.
It's not about that. It's just about recognizing what is happening and trying to understand what are the resistances and the blocks that are kind of holding us back from being in that full potential of healing.
And then self-forgiveness for doing that to yourself.
100%.
Yeah. Well, we could have a whole podcast on that. Maybe we will someday.
For sure.
So for those that are like, okay, I love her approach. Could you tell us a little bit about how do people find you? Like, who comes to you? Who are the main people that are the clients that,
I think you probably know that the clinic is impacted, I guess would be the word that I would use.
Yes.
Yeah. So
you're busy.
We're busy. We have a lot of people on a wait list, and we're doing the best we can right now to train and bring in other practitioners, but this medicine is, I think it resonates with people.
Yeah.
It makes sense. And then, the experiences that you can have transforming that healing crisis into the best thing that ever happened to you is a very powerful, it's a life journey. It's like maybe more of that. We do something called autonomic response testing, which is like testing the body directly for what is needed and what is stressing the body.
Love.
And those experiences sometimes give us really direct answers on multiple levels, even on the emotional level or things like that will pop through as like this pattern is linked to the tension in the liver and this belief that you have is it might be involved in here. And it's a pretty deep dive, and it's not for everybody. In fact, sometimes
it's important to say that too.
It isn't. Yeah. Sometimes it can be scary.
Yeah.
To really see yourself at that level.
Yeah. Yeah. So good. Anything from that? Anything that we've talked about that you've just coming up for you that you felt it's important to share that maybe we didn't cover today?
Oh boy. Well, I think the main thing is that there is a lot of hope. And I think when you work with a body like this, the statistics or whatever is said to you about whatever condition is happening, that's based on what services have been offered to you or to that illness in the past. And basically, it's meaningless if we're doing something differently. So if you're, sitting with a diagnosis of multiple sclerosis or cancer or something like that, I just think having hope that is really, which has been naturally supported at Ollie because of our experiences, like seeing us not really follow those numbers because of looking at this whole person in this way and supporting the body at the level of the traumas that have started the process or mediated the process. I don't know what the right word is there. So I think just having hope.
Yeah, and not comparing yourself to the statistics or the past or what somebody else has gone through.
We notice
or
that
anything.
When you go, a doctor has a lot of power. When you go to a doctor and a doctor tells you something about yourself, you have the choice to believe it or let it resonate with you or not. Yeah. And I think there's good intentions there, and there's based on the numbers, that probably isn't accurate information. They're very good at telling the truth based on the numbers. But what's missing there is the bigger picture of that's not the whole picture. So,
the bigger picture that's not the whole picture.
Yeah,
I love it. Yeah.
Yeah.
I hear that too. Yeah, that's important. That's beautiful. So, one of the things that we ask here, because my everything is heart wide open wellness, and the idea of living with a wide open heart, which you do. What does that mean to you to live with a heart wide open?
It means connecting to the center of myself and allowing that to be shared with others to my fullest ability, which, I think that it's a day by day practice, moment by moment practice.
Yes.
Right. Because there's stress and there's trauma and there's fear. And sometimes it's appropriate to maybe not have the heart wide open in that moment.
It is.
But I continue to reach for reopening or opening further, because that's where the true connection is, and through true connection is healing.
Beautiful. That was so fun. Thank you so much for being here today.
Thank you for having me.
I know so many people are going to get things out of it, but I would say my takeaway would be the hope too. Just that we can heal, that there's so much available, and that just this simple things. It doesn't have to be overcomplicated to move the needle a little bit. Yeah. And
that hope, it could be on death's door even.
Yeah.
It is like remarkable what you can accomplish. And those illnesses, if they're viewed as the bad guy, we're missing a very important piece, which is the blessing that comes through them. And figuring that out is actually what shifts a lot of things to moving into healing.
And if we were to talk for another hour, which we could, I think that's where I would go with these healing crisis kind of concept, and how important it is but also just how much more enjoyable life is when you realize the perceived failures, the perceived challenges, the perceived, things we have to go through, even if it's a physical thing, can be the introduction to something more beautiful, more healing, more everything.
I love how you said it's more enjoyable. I also think, someone say, well, how do you know that's true? Well, I don't need to know it's true. It also feels good to see it, but it does resonate, but sometimes, is it better to be happy or right? I don't know. I think happy.
I think so too. So funny. One of my favorite quotes is, "The purpose in life is to be happy," by the Dalai Lama. But it's not an easy thing to do.
No.
Dalai Lama isn't simple. It just sounds simple.
So true.
It's so fun. Thank you so much.
Oh, you're welcome.
Adore you.
Thank you.
Thank you for joining us on the Heart Wide Open Wellness Podcast. We appreciate your time, energy, and attention. Whether you're watching or listening, please remember to follow us on Facebook, Instagram, TikTok, Apple Podcasts, Spotify, iHeartRadio, and YouTube. Stay up to date with us at heartwideopenwellness.com so you don't miss any upcoming events, offerings, or retreats. Until next time, keep your heart wide open.